Hello and welcome back to Proactive New York. Joining me right now is Gerald Commissiong, CEO at Todos Medical. Gerald, good to see you again. How are you?
I'm doing well, thanks. How are you?
I'm good. Thanks so much for asking. So the big news of the week is that the firm has struck a distribution partnership with South Korea's Osang healthcare company. So Todos will be distributing their GeneFinder Coronavirus Plus RealAMP kit. Can you tell us about the GeneFinder and how it works?
Sure. So the GeneFinder looks for 3 genes that are specific for COVID-19. And in doing so, you use the RT-PCR process where you amplify the virus and you determine basically if there is virus by confirming the genes, and then what the quantity of virus is. You get a measure of that using something called cycle times, or CTs, which tell you basically how fast you can pick up the virus. The faster you pick up the virus, the more virus there is.
And so why is PCR testing so important right now?
Well, the unfortunate reality is that the rapid tests, the antigen tests, they're just not biologically suited to pick up asymptomatic spread. And as we know, that is really the biggest risk, especially as older people are vaccinated, and we're seeing in the numbers more and more young people are getting diagnosed. Younger people are more likely to have asymptomatic cases because their immune system is a little bit better. And so as time goes on, the utility of the antigen tests to screen people will become less and less as younger people are the primary responsibility of spreading this disease. And so you need things that are more sensitive to pick up the virus, not just the antigen of the virus.
And is it your first time working with the Osang healthcare company?
So we've been working with them for the last several months, doing validations, worked on a few other kits. And so, we formalized this arrangement with them because we're now, with many of our clients, we're seeing that, people are looking for tests that have EUA. We're looking to expand the utility of those tests, especially with saliva testing and at-home testing. Those are things that are becoming priorities for the incoming administration. And with schools opening up, many parents are concerned about their kids having nasopharyngeal swabs, on a consistent basis. So, getting an EUA kit that we can then work to establish an EUA saliva-based method is something that is becoming increasingly important.
So how will you leverage your customer base to actually get this distributed? What's the plan going forward?
Well, we're moving many of our customers into the GeneFinder kits from certain other kits that we've been using in the past. As we go out and we market to new customers, we're putting this as part of our offering. And importantly, we're helping Osang get the data needed to be able to submit to U.S. regulators to make those additions with the saliva kits. And that, especially as we head into the summer and the fall, where a lot of the testing is going to become more routine and go to younger people, that seems to be something of convenience that's extremely important.
Looking forward to it. Gerald, thanks so much for the time today.
Thank you.